Dr. Mike Ellman from Panorama Orthopedics, and today we're going to talk a little bit about bursitis. So bursitis is actually an inflammation of the bursa sac, is the technical definition for it. And what it technically means is that the bursa, which is, we actually have hundreds of them throughout our body, they kind of act like oil or WD-40 throughout our body, and they allow multiple different structures to rub over each other in a rather frictionless fashion. And when the bursa gets inflamed, it kind of turns into rocks. And so you have two very tight structures or muscles or tendons rubbing over bone, and the bursa lives in between. And when the bursa turns into rocks, frankly, it hurts, and patients have a lot of pain. And when patients come into my office and they specifically say, I have pain on the outside of my hip, not really the front of the hip, not really the back of the hip, but the side of their hip, it's pretty common. By far the most common diagnosis is what we call trochanteric bursitis. And essentially you have a bone, on the outside of that bone you have a bursa, and on the outside of that bursa you have what we call an iliotibial band, the IT band. It's kind of like a tight rubber band. When that rubber band gets too tight, and I see it all the time in runners, I see it all the time in patients who come in with pain for long periods of time and they have gait imbalance or muscle imbalance about their hip, you can get a bursitis. The bursa can get inflamed, you get underlying rocks in there, and it hurts. Fortunately, from a treatment perspective, we're able to treat this without surgery. 99% of the time, the patients I see with bursitis, we're able to basically cure their symptoms without any surgical intervention or anything invasive. What it typically involves is a course of physical therapy to work on rebalancing of the muscles about the hip, stretching out the IT band. It also involves injections. I'll typically start with a cortisone injection, which is a steroid, taking a bunch of Advil and just pounding it right into that bursa. And what it does is it really dissolves those rocks, kind of creates that oily substance again, and recreates normal anatomy. It gives people significant pain relief. If we have to do 1 or 2 injections, that's fine. It typically takes patients anywhere between a couple weeks to a couple months to get significant pain relief from non-operative treatments.